शकतो?
it is a good question. Diabetes, initially what we call it as a silent disease or a silent killer. It is very true for diabetes having kidney disease. Initially, most of the time, the patients who have diabetes are unaware of any organ disease or organ damage, and that is why they feel that it is a silent thing. But as the years go, and as kidneys, eyes, and other things starts getting affected, the patient's lifestyle and all these things change. They start having symptoms very late, and that is very true for kidney disease and diabetes. Unfortunately, it is true that till 80% of kidneys are damaged, you don't have symptoms, and symptoms start very late. By the time the symptoms come, you go to the doctor, you see him, it is already the disease which has gone very far ahead. Now, the best thing definitely, as I said, is to sort of prevent kidney disease and diabetes by good control of diabetes, by good control of blood pressure, avoid painkillers, go to your doctor regularly and get your sugars and A1C and blood pressure checked. Now, once you have kidney disease or kidney failure because of diabetes, you have two options. You have dialysis or you have kidney transplant. Kidney transplantation is the best treatment for any patient with kidney disease, provided he is not having any other complications. So, up to the age of 70 years, we say kidney transplantation should be done for each and every kidney disease, provided they have a good heart to withstand that operation. Or else they can live on dialysis, which is either done in the hospital or you can do it at home, something called as home dialysis. So, you can still live a very normal, very good life with the help of these treatments.
Achha. And he asked about the economic factor of this.
Economy, yeah, unfortunately, kidney disease is a very expensive illness. All the treatments which are there, but as I said, prevention in kidney disease is very doesn't require any cost.
Yeah, correct.
If you are aware and if you are aware about your health, you require medications just rupees 1 or 2 rupees tablets which prevent kidney disease. But once you have kidney failure, treatment is expensive. As far as economic goes, transplantation is still the best treatment as far as even the economy goes, because dialysis expenditure is never going to reduce, whereas transplantation expenditure reduces.
Okay, doctor, thank you. We have got another question. Hello.
माझी मम्मी किडनी स्टोन होता
खंय आसा
आणि तिका दोन्ही साइडीन कमर सुजता आणि गॅस जाता.
अच्छा, एनीथिंग वुड लाइक टू आस्क? दोन्ही किडनी स्टोन एके साइडीक आसा दोन्ही साइडीक आसा? हॅलो,
एक साइडीन आसा.
एके साइडीन आसा,
लेफ्टान आसा.
आणि खंय आसा तो एक्झॅक्टली? किडनीन आसा काय मदी वाटेक आसा, पायपान आसा?
एक्झॅक्टली तिका देंवलो तो, मागीर तेजी ट्रीटमेंट बी केले.
आता स्टोन ना? स्टोन आसा काय पडलो?
आता अजून चेक करून ना, 1 वर्ष झालं चेक करून, आणि तिका दोन्ही साइडीन कमर सुजता आणि गॅस जाता.
आता जे काही त्यांचे लक्षण आहेत, कंबर दुखतायत किंवा गॅस जातात, तर सध्या त्यांनी ॲटलिस्ट एक सोनोग्राफी आणि एक युरिन टेस्ट करून बघणे गरजेचं आहे. कारण किडनी स्टोन हा रिकरंट डिसीज असतो. 5 वर्षानंतर साधारणतः 50% लोकांना होतो. त्यामुळे त्यांनी सोनोग्राफी आणि युरिन एक्झामिनेशन करून बघणं गरजेचं आहे, आणि त्याप्रमाणे जो काही आजार असेल त्याच्यावर उपचार करता येईल.
ओके, वी गॉट अनदर क्वेश्चन. हेलो. येस.
हेलो.
विचार.
डॉक्टर, माझी राईट साइड आयडी किडनी बटव्यार स्टोन आशिल्लो, आणि आता तो स्टोन म्हजो गेला, पण म्हाका सायडीक पेन जाता कसतो.
स्टोन जर गेला असेल आणि पेन येत असेल
कंटिन्यू मध्ये केन्नाय पेन येता.
बरं, तर स्टोन हा काही पेनचं कारण नाही, बाकीचे काही कारण असण्याची शक्यता आहे. उदाहरणार्थ मसल पेन किंवा स्पायनल पेन वगैरे असण्याची शक्यता आहे. एकदा स्टोन निघून गेल्यानंतर शक्यतो पेन वगैरे व्हायचे काही कारण नाही.
आय एम जस्ट आस्किंग अ सब क्वेश्चन. युरेट्रिक स्ट्रक्चर वगैरे त्याला काही असू शकतं, म्हणजे जस्ट प्रोबॅबिलिटी. आय एम जस्ट आस्किंग.
स्टोनचा उपचार जर त्याने करायला वेळ केला असेल आणि जर स्ट्रक्चर तयार झाला असेल तर डेफिनेटली लघवी करताना वगैरे कमरेत भरून येणे किंवा कमरेत दुखणे हे
पॉसिबल. मला सांगा डॉक्टर की नाव इन युअर प्रॅक्टिस की इकडे म्हणजे लोकॅलिटी म्हणजे काणकोणची there is a lot of kidney disorders or kidney disease are prevailing in this area. What can be the probable cause and how to see आता बऱ्याच लोकांचे जे स्टडी आहे म्हणजे those lot of efforts have been done by the government, though I don't say it is magnificent, but तरी सुद्धा they have not derived a definite conclusion yet. But as a matter of fact, how to prevent further damage or of the people who are already staying in this locality, or have you observed anything, or have you got any correlation with their food habits or their geographic distribution or any water or this thing, or how you will manage this issue?
The issue of kidney disease in Kankon and South Goa definitely is still there, and unfortunately we still don't know what are the
causative
reasons,
factor.
what is the exact reason, we still don't know.
Yeah.
Because by the time the patients come to us, they already have kidney disease which is established.
Yeah.
And then at that stage, it is very little in our hands to really prevent the further downhill course. Though we still try and give them a proper diet, basically low protein diet, avoid red meat, eat more of vegetables, take blood pressure medicines, avoid painkillers. But since we still don't know what is the exact cause, we still cannot pinpoint one particular
reason for that. Yes. But overall, suppose if you want to like see what preventive measures these people should take, as you rightly said about the food habits, or second thing, as you have said at the beginning, drink a lot of water.
Yes.
Perhaps that can be only.
Yes, absolutely. I mean, one other thing is these people probably have been found to have eating a lot of dried fish. So
they must practically less salt as well as dried fruit should be this. Doctor, we have got another question. Hello.
हॅलो डॉक्टर, हांव स्वाती नायक गोवा वेल्लाच्यान उलयतां.
स्वाती विचार.
म्हाजो असो प्रश्न आसा की एक जेन्ना किडनी फेल जाता तेन्ना दुसरी सुद्धा किडनी कशी फेल जाता डॉक्टर?
अशी त्यांचा प्रश्न असा आहे की
एक किडनी फेल झाल्यानंतर दुसरी कशी फेल होते म्हणजे ऍक्च्युअली
काय असते की जो काही आजार असतो तो मोर ऑर लेस दोन्ही किडनीना
सारखाच बाधक
असतो. मग डायबिटीज, ब्लड प्रेशर किंवा क्रॉनिक ग्लोमरुलर नेफ्रायटिस किंवा हेरिडिटरी इलनेसेस हे दोन्ही किडनीला एकत्रच येतात. बट काही आजार असे असतात, मग उदाहरणार्थ स्टोन, किडनी स्टोन एका साईडला होऊ शकतो, दुसऱ्या साईडला होणार नाही. किंवा काही लोकांना जन्मजातच एक किडनी लहान असते, किंवा काही लोकांना ऍक्सिडेंट किंवा इंजुरीमध्ये एका किडनीला मार बसलेला असतो. तर अशा वेळेला आपली एक किडनी खराब होऊ शकते आणि दुसरी नॉर्मल असू शकते. आणि एक मात्र आहे की समजा एक किडनी जरी आपली खराब असेल किंवा ती काढून टाकली तरी दुसऱ्या किडनीवर आपण पूर्णपणे नॉर्मल आयुष्य जगू शकतो. म्हणजे आपल्याला नॉर्मल जगण्यासाठी एक किडनी, एक चांगली किडनी असणे फार गरजेचं आहे. दुसरी किडनी खराब असेल किंवा जन्मजात लहान असेल किंवा ऍबसेंट जरी असेल तरी त्या व्यक्तींना किडनी आजार असं काही होत नाही. त्यामुळे फार क्वचित एकच किडनी खराब होते. युजली दोन्ही किडनी
सायमल्टेनियसली इन्व्हॉल्व होऊ शकतात. बरोबर. फक्त आता ह्या पेशंटचं ट्रीटमेंट म्हणून त्याला एक किडनी आपण घालून त्याला वाचवू शकतो, म्हणजे वी कॅन सेव्ह इज फर्दर दिस, म्हणजे ट्रान्सप्लांट म्हणतो मी.
ट्रान्सप्लांट हे दोन्ही किडनी खराब झाल्यानंतरच करतो.
बरोबर, तेच
किडनी खराब झाल्यानंतर.
सो वन्स ही गेट्स अ न्यू किडनी, वन फंक्शनिंग किडनी, ही विल बी टेकन केअर ऑफ. डॉक्टर, आपल्याला एक प्रश्न आहे. हॅलो.
हॅलो.
हा, विचारात.
Yeah, doctor, I wanted to ask one question. This is regarding the peritoneal dialysis.
Yeah.
The peritoneal dialysis which can be done at home, but there is a fear of the infection.
Yeah.
So is that I wanted to compare with this hemodialysis and the transplant. So I wanted to ask this question to Dr. Shital, how we can explain that which is better therapy and how to remove the fear of this peritoneal dialysis from the mind.
Actually, बराच broad based question. He wants to know about the peritoneal dialysis, he wants to know about hemodialysis, he wants to also know about the kidney transplant, and he also know how to remove the fear from the peritoneal.
Now, all these three therapies are not separate. They are all interlinked.
Correct.
But as I said, for each patient, we decide which is the best treatment.
Correct.
On an average, transplantation should suit each and every patient. So transplantation is the best possible treatment for each and every patient, unless there are some medical reasons. Now, home dialysis or peritoneal dialysis is a very good treatment modality. आणि बऱ्याचशा देशामध्ये home dialysis is the first treatment which is given for all patients. Now, उदाहरणार्थ places like Hong Kong and Thailand, home dialysis is the treatment which is given for each and every patient with kidney disease as the first treatment. If they are not suitable किंवा काही प्रॉब्लेम असेल तरच बाकीचे ट्रीटमेंट करू शकतात. येस, सो इट इज अ गुड ट्रीटमेंट. आणि इन्फेक्शन हे असं काही रिस्क फॅक्टर नाही आहे त्याच्यामध्ये. इफ इट इज डन प्रॉपरली ॲट होम इन अ गुड एन्व्हायरमेंट दे शुड नॉट बी फिअरिंग ऑफ एनी इन्फेक्शन. आणि ऑल दिस 3 ट्रीटमेंट, हिमोडायलिसिस, ट्रान्सप्लांट, पेरिटोनियल डायलिसिस, आर more or less sort of interlinked treatment, and each treatment has got its own advantages and disadvantages, but for that particular patient, whichever is beneficial and right is what we advise.
थोडंसं जरासा explain करून what you mean by peritoneal dialysis and what you mean by hemodialysis, just in the interest of our viewers.
Now in hemodialysis, hemo stands for blood. Hemodialysis मध्ये what we do is the blood is directly taken outside and it is purified and returned back to the patient
through a machine.
Through a machine.
Yeah.
So it is what we call it as extracorporeal. It happens outside the patient's body.
Yeah.
So that is hemodialysis.
Yeah.
Whereas in peritoneal dialysis, the fluid is put in the patient's abdomen. Dialysis takes place inside the patient's abdomen, in the abdomen itself, inside the body. So that is the main difference. One is clearing outside the body, the other is clearing inside your own body. So that is the main
difference.
Basic difference. Now hemodialysis has to be done in the hospital. It is done with the help of machine. You require trained staff.
Correct.
And you have to come to the hospital on an average 2 to 3 times in a week. Most of the patients require 3 times a week. Whereas peritoneal dialysis is done at home, and it has to be done daily. It has to be done daily on an average 2 to 3 times in a day. And the patient does it by himself. So the patient is taught how to do at home. And as I said, there are advantages of home dialysis. You don't have to come to the hospital. You don't require something called as a fistula, which you do for hemodialysis. And if you have underlying heart disease, home dialysis is much safer, much better. If you are staying far away from the hospital where you have to travel, then this therapy is much better. Whereas hemodialysis is suitable for people who probably can't take care of themselves at home. Who have previous abdominal surgeries, who have been operated, who are obese, who are much more obese. Then in those cases we ask them to come for hemodialysis. So the basic principle, as I said, is one is done outside the body, one is done inside the body, and based on the patient we decide. But as far as the recent treatment modality is concerned, peritoneal dialysis is supposed to be the first choice for each and every patient. It doesn't disturb your day-to-day schedule. So that is more important.
Okay, doctor. It is a really good discussion is going on. Let's take a small break and then we'll restart with the program. एक लहानसा विसर्ग घेता आणि परतून सुरू करूया.